Welcome to another educational video from Lotus Medics. I am Dr. Sachin Kotasthane and today we're going to talk about laparoscopy. What is laparoscopy? Laparoscopy comes from the two words lapros, which means abdominal wall, and scopos, which means looking inside with a telescope. So essentially a laparoscopy is looking inside the abdominal wall with the use of a telescope called the laparoscope. This is a minimally invasive treatment option which is used both for diagnosis and treatment of certain conditions. Under a general anesthetic, your surgeon will make a keyhole incision and fill up your abdomen with carbon dioxide gas and insert a telescope to look inside to diagnose and treat several conditions. Further keyhole incisions are made depending on the type, the complexity of the surgery and the nature of the pathology. Laparoscopy is a gold standard for treatment for conditions like endometriosis. It is usually a day case procedure that is done under a general anesthetic, and most women will go home the same day. However, in more complex conditions like severe endometriosis treatment or a hysterectomy, which can also be done laparoscopically, some women may need to stay in overnight. But in most situations where conditions like ovarian cysts are treated, or there are infertility investigations, or there's treatment to mild to moderate endometriosis, most women will be able to go home the same day. A laparoscopy is a less invasive procedure and it has several advantages over, say, a laparotomy, which is a cut in the tummy. There's a lesser chance of infection, there's lesser pain, there's quicker recovery, there's less risk of clots in the legs and lungs, and women are generally able to be up and about and resume their routine activities much quicker. Before the surgery, your surgeon will discuss the procedure with you and explain all the risks and benefits in your individual case. They'll also take what's called an informed consent. The risks of the procedure are divided into serious risks and those that are more common. And thankfully, the serious risks are not as common and the common risks are not very serious. Some of the risks of this procedure are things like bleeding, which is usually light. And if there are bleeders, they're usually either cauterized or stitched. There's a chance of infection, but usually women receive antibiotics as a prophylactic measure to prevent infection. There's also a very small risk of injury to the visceral organs such as bowel or bladder, but that's usually very rare. There is usually a risk of clot in legs and lungs, and there are several measures to reduce these risks. Patients, when they wake up after the surgery, may have some shoulder tip pain, and that's because of some trapped gas which can irritate the diaphragm. The shoulder tip pain usually resolves after a few hours after the surgery as the gas dissipates, and it usually responds really well to simple analgesia and some heat packs. Your surgeon will usually come after the surgery and explain the findings of the surgery. You will be allowed home once you're comfortable and are able to go home. It is advisable that you have someone to come and pick you up from the hospital, as you will be groggy after the anesthetic, and also have that person stay with you overnight. In certain situations where your surgery is a little bit more complex, it may be necessary to keep you in overnight to make sure that we give you some stronger analgesia and look after you. It may take some time for the anesthetic to wear off. Most modern anesthetics are short-lasting, so this shouldn't take a lot of time. But please make sure that you're not operating any heavy machinery or not doing anything too strenuous on your own until your anesthetic completely wears off. As far as scars and dressings go, you will have some dressings on your abdomen, including some steri strips. These are usually waterproof, which means you can shower with them. Keep these on for 4 or 5 days and then you can take them off in the shower. Usually keep the wounds nice and dry. Try not to apply any lotions or potions on them. Your sutures will usually be dissolvable unless explicitly stated so. These will dissolve in a few weeks. It's not unusual for the sutures to pop out of the wound, especially as the wound contracts. So if you're feeling a stitch or so, don't be afraid, don't worry, this will disappear and dissolve. If you have any red flag symptoms, and there's a list of those symptoms and a separate video on the website for you to refer to, please inform us and we will see you as soon as possible. Depending on what procedures you may have had along with your laparoscopy, you may also experience some light bleeding. As long as it's not heavy, don't worry. There's also a list of red flag symptoms on the website, and there's a video which also demonstrates what to do if you have those symptoms. If you have any of the red flag symptoms, please call us on 1300-356-887 and we can make an appointment to see you as soon as possible. Prevention of formation of blood clots. Now let's look at how we can reduce our risk of clots in legs and lungs after the surgery. This is a small risk but can be quite significant. So these are the instructions to prevent this from happening after the surgery. Make sure you're ambulatory as early as possible. Do a couple of these exercises like pumping your foot up and down every 30 seconds, rotating the ankle in a clockwise and anti-clockwise direction for 30 seconds, and making sure you're wearing your TED compression stockings till such a time that you're completely ambulatory. Also make sure that you keep yourself well hydrated. During the surgery, we take adequate precautions to make sure that you have calf compressors which will inflate and deflate, thus massaging your legs and preventing clots in the legs and lungs. In certain select conditions where women are at a high risk of developing venous thromboembolism, you may additionally be required to take anticoagulant medications for a certain amount of time after surgery. You may experience tiredness and exhaustion after a few weeks of your surgery. This is completely normal. This is because your body is channeling all its resources into the recovery, whether it be your nutrition or sleep. Make sure you keep a close eye on those and optimize those for the best healing process. There are detailed instructions and videos on things like activity after surgery, driving, and sexual intercourse on the Lotus Medics website. Please refer to them individually. Lotus Medics wishes you a speedy recovery through your laparoscopy journey and is here to support you at each and every step of your recovery process. This is general advice on your surgery. Your condition may differ and different women will recover at different rates of recovery based on their body condition, the type of surgery they've had, any comorbidities, the complexity of the surgery, and if there are any complications. We will inform you if there are any specific conditions that apply in your specific case. If you've liked our video, please like, share, and subscribe so that we can grow this channel and continue producing such educational videos to help your women's health needs. Thank you.